Hello, and welcome to a very special segment of the Smile Now podcast where we are doing Ask the Expert. I'm joined here with Dr. Caleb Stott, my partner here at Smile Now. Dr. Stott, thanks for joining me.
I'm really excited to be able to do this, and I think it's going to be really beneficial for people that are looking to do these treatments and looking to somebody that can help them out. Most of these questions come from all over the internet, so part of our job is to be aware of what patients are thinking and what they're feeling and everything like that. And looking online is one of the best ways to really understand what kind of information they're looking for.
So this is actually one of my favorite topics. So the patient's asking, I was just wondering, I see some people only getting 4 implants, but also a lot getting 5 or 6 on each arch. What goes into them choosing to do more implants? So this is actually one of my favorite subjects in implant dentistry. I get asked about this all the time. So at Smile Now, one of our big things is more than 4. So we're always talking about doing more than 4 implants. But I think there's some nuances to that conversation that are really important, right? So for a long time, the way we were replacing people's teeth was doing an all-on-4 procedure. On the upper, that meant we were putting implants all in front of where your sinuses are. So your sinuses are running through here. We're putting 1, 2, 3, 4 implants on the top. And then down below, you have 2 little nerves coming out of your jaw right here. And we do 1 and 2 here, and then 3 and 4 right here. So you'd only have 4 implants, which is, a perfectly reasonable thing to do. Millions of people have received this treatment all around the world, and it's worked very well. However, it does have some limitations that can be overcome by adding more implants. However, when we say adding more implants, we don't necessarily mean that you should be adding more implants within that same amount of real estate. When we're talking about adding 5 and 6 implants, we're talking about adding more implants behind that front 4 to give more spread over your prosthesis, to actually give you more teeth and more physically support the bridge to prevent breakage and implant failure over time. So when we're talking about doing more than 4 implants, we're meaning we're going to spread these out more, give you more teeth, give you more longer lasting prosthesis, and also mitigate some of the risks that can come along with any of your implants not taking, right? So the implants do have to integrate in your body. If you only have 4 implants and you lose one of those, you're going to absolutely have to have another surgery in order to replace that implant, because it's either an all-on-4 or a nothing on 3. That's kind of a joke that a lot of implantologists use. And so sometimes if you can over-engineer that a little bit, if there is bone available to add more in the back, you should do that. And that's why at Smile Now, that's a standard for us. If there's bone available, we're going to use it. And we don't even charge you more for it, because we know that that's going to last longer. It's going to require less likelihood for a revision surgery, and gives us more flexibility as things go, should things come up. So it's, and ultimately it gives patients more teeth and more chewing power. So that's why we do it that way. Caleb, would you add anything?
No, you said it perfectly. This kind of goes back. We talked about the importance of blood flow, right? So us trying to put as many implants into a small space as possible is not a good idea. And the long-term effects of that can be that you lose more than one of those implants, right? So it's not really about that. This isn't about trying to fit patients into a box again, but it is that if they have enough bone and we can place more implants, it's like an insurance policy against future issues should those come about. And I actually have a story about this. I had a patient that after I did her procedure, I did 6 implants. She got in a car accident. So she's going down the road, Corvette, hit somebody 60 miles an hour and flew through the windshield. A lot of impact, a lot of surgeries and stuff like that. 5 of her implants made it, 1 of her implants failed, right? What does that mean? Well, she 70 surgeries because of this. It was a very severe situation for her. But one of those surgeries was not having to replace implants, not having to, fix something, because we had the additional implants in place from doing it the first time when she had available bone. Yeah. So more than 4, that's kind of our motto. We do it as part of our treatment. It's important to us because it's important to patients. They're going to be so grateful for it if they ever need it. And if they don't need it, awesome. At least we had it there just in case. You got it. So I had my uppers done 3 years ago and have had nothing but issues. My middle posts have already failed and it's infected, so it has to be removed. But he says he's not replacing it. I still bite my cheek and tongue all the time. They're too big for my mouth and they protrude out. My dentist just says that it is my bite, yet I had straight normal teeth before. Anyone have these issues? Just very frustrated after spending all that money. Oh yeah. So this is, we just talked about another situation where somebody had a really hard time. And I do think that patients, when they're having a really hard time, they go to the internet to try to figure out what's up and what's down, right? I don't know, hard to assess this case, not having all the information, but one of the most important things that I would say is that when you're going to have these procedures done, that you go to somebody that's been doing this for a really long time. And I also would say everything under one roof you're going to get better results. So like, for example, in my practice, I have a board certified prosthetist as a partner, and then there's me, and we've done thousands of these cases together, and we just know what teeth should look like, where implants should be, what kind of support they should have. This is what we focus on 100%. It's kind of like the principle of a laser, right? Like if you're going to have a laser, the only reason that a laser works as well as it is because it's so concentrated, it's so focused. It focuses all that energy on one tiny little location, right? And that gives it all the power in the world to cut through glass, cut through rock, do whatever it is that it's supposed to do, right? If you take that same amount of energy and you spread it out over a whole bunch of different things, it doesn't do the same thing at all. And so I would say and recommend to anybody looking to get this procedure done, like you want to go to people that are doing this all the time, people that have the proper training, people that have the proper experience. I'd rather go to somebody, if I broke a leg and had to have it pinned or something, I'd want to go to the doctor that does this more times than anyone else. And if I had to wait an extra 6 months to get that done and go to the right person, that's what I'm choosing to do. So.
Yeah, no, I totally agree with that. And I think one thing that really speaks to this question, especially, is you mentioned having all of these things managed under one roof. So it's not just the implants and the surgical component of the treatment, but also the teeth that go on top of that as well. So this patient is having two types of complications. They're having one, an implant failure, which can be a surgical complication, or it could be, a complication with the teeth themselves. And they're also uncomfortable with the teeth. They protrude out too much. They're biting their cheeks and things like that. This is what can arise when you have two different quarterbacks that are responsible for totally different things, right? And so as a patient, when you're having a combination of these issues, it gets really hard to get them resolved because you have one person fixing one type of thing, another person fixing another type of thing, and they don't even work in the same place, right? So having someone that is responsible, having the person that places your implants also be responsible for the teeth, it just creates a better system of accountability where when you're having issues, those can be solved from either end. Because sometimes these complications are a combination of the two. So you want the same person to fully understand comprehensively the type of treatment that's being rendered. And there's no reason that those should have to be two different people. Now, in your office, I think that makes a lot of sense. You got two people that are specializing in different parts of it, but they literally work in the same office. They're doing the same thing. They're just passing the ball to each other. That makes a ton of sense. And you two can even work in combination on a case if both of you are needed for something. And so it's just, in this day and age, with as much training as out there, with as many experienced dentists doing what we're doing, patients deserve better. Like, they shouldn't be having to get tossed back and forth between multiple providers for treatment that can be done under one roof, at least in my opinion.
Yeah, I totally agree.
For sure. This was actually posted in one of the 3-on-6 groups that we're part of. And the person says, I'm confused on what 3-on-6 means. I've been scouring the comments to understand through context, and it doesn't explain in these pages about section. Can someone explain this to me? So if you have found your way through all the different ways to do implants, you've probably come across the 3-on-6 modality. So here at Smile Now, we have several 3-on-6 providers, myself included, you as well, Dr. Stott, and as well as our third partner over in Denver, Dr. Poppy. We're all doing 3-on-6. And this is a really, really cool treatment, right? So what we're usually doing is all on 6 or all on X, meaning that all of the teeth are based off of however many implants, right? When we're talking about 3-on-6, what that's saying is there's 3 different bridges on 6 implants, meaning that 2 implants per bridge across the arch. So you've got one segment here, one segment there, one segment there. Each of these are being supported by at least 2 implants, and so you get that 3-on-6. There's a lot of advantages to that. For one thing, this speaks to, in another question, we were talking about the FP1 just replacing the teeth themselves. When we're doing the 3-on-6 procedure, that's all we're replacing, just the teeth. And we've actually segmented things across the arch, which makes it a little bit more realistic and similar to actual teeth. It also can create more strength. So when we have one thing going all the way across, just replacing the teeth, it can be a little bit more brittle than some of those thicker prostheses that we also do. And so by splitting them apart and having 3 different sections, you've created them a little bit more strength because it's a shorter segment, right? Like if I wanted to break a stick, it'd be a lot easier to break a long stick than a short one, right? And so by making those segments shorter, you make them stronger. And essentially that's what 3-on-6 does. Now there's a lot of other advantages that go along with it, like keeping your natural bone, your natural gums, having a more natural smile, having it feel more like natural teeth. But specifically when we're talking about 3-on-6, that's what we mean. We've segmented things. We have different sections. Any other clarity you would add to that?
Yeah, no, you did a really good job. I would just say there's a nuance between what an FP1 is and what 3-on-6 is, and 3-on-6 is a subset of FP1, right? The only difference is because they're segmented, should anything break in the future, right? You're only replacing like the 3 or 4 teeth on those 2 implants that have broke on, right? So repairability is a little bit easier in
Good
that
point.
aspect. The other thing is you can still floss between them, right? So look, people want to feel as normal as possible, and you floss and clean full arch teeth different than you do your natural teeth, but 3-on-6 gives you the ability to floss in between segments of those teeth, not all of them, and it just gives you a little bit more like a, you feel like yourself, you feel like what you felt like before to have natural teeth. And I would say probably the biggest benefit of it too is just it's a FP1 restoration, fixed prosthesis 1. That just means that the teeth are smaller, they resemble the normal size, they don't have a big amount of bulk to them, and people love that. Like that is what I would say is the biggest advantage of that specifically.
Agreed.
It is really difficult to get all the information, get really good information, and that's why I'm glad we're doing these segments for patients primarily, is to help them. And I hope that when they see this, if they have any specific questions, they just drop it down in the comments for us. If you want to send us x-rays, if you want to like kind of get like a second look on something, we'd be happy to put that on these segments and kind of speak to you directly if that's beneficial to you.